Ear, Nose, and Throat of Utah, we have 13 physicians. We have throat cancer specialists. We have an otoneurology specialist. Also, a lot of our physicians handle pediatrics for sinus issues and allergies, as well as all sinus issues. We like to have everything in-house, not having the patients to go to hospitals to schedule a CT scan, because that can take upwards to 2 or 3 weeks when you need a CT scan now. Our doctors don't really do anything with CT except for order the CTs and read them. When the CT scanners go down, the doctors know because they can't get their patients in. Our previous machines were having parts issues, trying to get parts in. It was taking longer to get them fixed, so Brown stepped in and replaced all of them with Fuji scanners. They're all the same scanners, they all run exactly the same, and Fuji has a reputation of not going down quite as often as our past scanners. They basically just came in and did everything. It was a very large project for our downtown office. It's a tight fit. They had to arrange 3 different companies, electrical company, a rigging company, and then the engineers themselves to put it in. I just had to tell my doctors a timeline. I might have taken credit for some of it, but the Brown's medical imaging team, they got 3 of them done within a month. I've worked with them for years. They're very reliable. Where I lack the knowledge of building a room for specs for a room, things like that, they come in and they have the knowledge to tell me what I need to do. Brown's is great. They help me out whenever I have a question. They're right there for me to answer any of my questions, and if they don't know it, they'll find out from somebody in the company knows.